Assalamu alaikum and very good morning. I'm honored to be here to present my paper. The title of my paper is Assessment of Psychological Distress Among Advanced Cancer Patients. Cancer has emerged as a major global health challenge leading to significant mortality and morbidity. By 2030, it is projected that cancer cases will increase by up to 70% compared to the previous decade. In Bangladesh, it is estimated that over 2 lakh new cases are diagnosed yearly. Advancement in anti-cancer treatment have significantly improved survival rates, but they also have led to increased psychological disease among patients. Nearly two-thirds of cancer patients experience emotional challenges such as stress, anxiety, depression, loss of appetite, loss of interest, with some even contemplating hasten death. What is psychological distress? According to the National Comprehensive Cancer Network, cancer-related distress can be defined as a multi-determined, unpleasant emotional experience of a psychological, social, and/or spiritual nature that may interfere with the ability to cope effectively with cancer, its physical symptoms, and its treatment. The link between physical and psychological factors in healthcare is complex. Poorly managed pain and physical symptoms can trigger distress, depression, anxiety, even desire for hasten death. Similarly, untreated depression and anxiety can impair effective pain management. Objectives. General objectives of this study is to assess psychological distress in terms of physical, emotional, social, spiritual, practical concerns among advanced cancer patients attending palliative medicine department in a tertiary care hospital. Specific objectives were to find out the relationship between the psychological distress of patients with their socio-demographic, disease-related variables, and clinical symptoms. This study was cross-sectional study, and it was done in the Department of Palliative Medicine of BSMMU, and duration was 2022 to September 2023, and it was purposive sampling, and study population one was 176 advanced cancer in inpatient service of palliative medicine department. Data collection was by a questionnaire consisting of two parts. First part contains the socio-demographic variables, disease status, treatment-related variables, and performance status by ECOG scale. And the second part was the Bangla version of NCCN distress thermometer and problem list. The distress thermometer is presented in a 0 to 10 scale. Data analysis was done in SPSS 26 version, and qualitative data that were expressed in frequency, percentage, table, and graphs. An association of categorical data were revealed by chi-square and Fisher exact test. Now, result. Distribution of patients by socio-demographic characteristics shows that among all our participants, approximately 60% were aged over 50 years and near equal distribution between male and female participants. Most patients belong to the lower middle income group, and distribution of patients by symptoms shows most common symptoms were pain, loss of appetite. Among physical signs, anemia was the most prevalent. Here shows the most diagnosed malignancy among all the participants occurs in the gastrointestinal system. And this table shows that the most common site of metastasis was in the liver. And distribution of patients by time since diagnosis shows that around 70% of patients came to palliative medicine department within 12 months. That means within 1 year of cancer diagnosis. And this graph shows that 80% of patients knew that they have been diagnosed with cancer in any part of their body, and 50% patients were aware about their prognosis. It shows that 50% of patients had already undergone surgery and 60% had received chemotherapy before coming to the palliative medicine department. Distribution by ECOG performance shows that more than 50% of patients belong to grade 3 and 30% were bedbound. This table indicates that shows that more than 80% was was suffering for more than cutoff value more than 5, and distribution of this patient of problem list of the problem list of the distress thermometer was shows that most patients facing financial and dealing with the partner, and among the physical problems it was faced by the fatigue. Association of patients with the socio-demographic with this test score revealed that marital status, lower treatment expenditure, shorter time since diagnosis were significantly associated with higher distress score. This table showed that patients who were not aware of the prognosis experienced higher distress. This table shows that those patients could not access to surgery or radiotherapy experienced higher distress. Association of ECOG grading that distress score showed that patients with higher ECOG grades experience higher distress. Association of distress thermometer problem list shows that child care and depression, fear, nervousness, sadness, worry present with the higher distress, and no association with the spiritual concern. There are some limitations of this study. The study was the cross-sectional design which did not include any follow-up or intervention for high-risk patients. And the second one is that since distress level may fluctuate, the study did not include repeated assessment at appropriate intervals, which are essential for accurately identifying clinically significant psychological issues. And the conclusion, this study highlights the need for prompt assessment of psychological distress as soon as advanced cancer patients are admitted. Regular screening for psychological distress and palliative care enables early detection of distress, symptom management, treatment, effective end-of-life care planning. These are the references, and thank you.